Before we discuss the surgical treatment of obesity, I think it's important to understand the disease that we and our patients are fighting. The disease of obesity affects millions of Americans each year. As a serious disease, there are many factors causing a patient to develop obesity over their lifetime. There are genetic factors, things we inherit from our parents, that predispose us to the risk of developing the disease. There are individual differences in people's metabolism, especially with increasing age. And there are environmental causes, including types of food available and daily activities. All of these taken together increase the risk of associated diseases, including heart disease, diabetes, high blood pressure, and some forms of cancer, and many other diseases. The disease of obesity kills 400,000 Americans each year, as much as smoking and some forms of cancer. And as a serious disease, the disease of obesity needs to be treated with the best tools that are available, which has been proven to be a combination of surgery, diet, and exercise. On an individual level, let's talk about some numbers that go along with obesity, specifically the body mass index, or BMI. The BMI is based on a combination of a person's weight and height and can be easily calculated by using the BMI calculator link on our website. The BMI number is important because we know that patients with an elevated BMI above 35 or in the range of what we call morbid obesity will go on to experience serious and life-threatening health risks related to their weight over the course of their life. And for that reason, surgery is indicated for those patients whose BMI is above 35. When a patient gains enough weight to reach the BMI level of morbid obesity, over the course of their life, the extra weight that they carry directly damages many of the organ systems and functions in the entire body and causes what we call obesity-related diseases or comorbidities. And it's these obesity-related diseases that include the well-known diseases such as diabetes, heart disease, blood pressure, sleep apnea, and a wide range of joint and back problems, but also does include some less well-known conditions such as acid reflux or heartburn, hormone imbalances, infertility, and even some forms of cancer. Developed over a lifetime, it's all of these obesity-related diseases that will greatly damage a patient's health and ultimately cut short their life. Obesity also leads to a host of other issues in somebody's life, including social issues, hygiene issues, mobility issues, issues at work, and even discrimination and prejudice. But thankfully, many of these issues will improve as patients lose their weight. Now, many of our patients have enjoyed temporary success with medical weight loss over the course of their journey. It's very usual for our patients to have lost 20, 30, or even 50 pounds, but eventually the weight comes back over time. Only 2% of all of our patients who come to us have had success with long-term weight loss for morbid obesity, and for those patients, we're happy and it's a fantastic result. But if the patient is in the 98% group who have lost weight but then it's come back at some point, they shouldn't feel guilty about that, but it just means that the additional tool of surgery is needed to come alongside the diet and exercise to help better accomplish their long-term success. Surgery, when combined with a new healthy diet and exercise, will help you be more successful with your weight loss journey. It doesn't erase the battles that still need to be fought on a daily basis. Patients still have to eat good things and be active in their everyday life. However, we've seen the great results in our patients who have used the added tool of weight loss surgery to greatly improve their health, which leads to a longer and a richer life.